Hello, good evening. So I hope everyone is okay. So right now we are going to start the psychiatry class. If you find any problem, if you could not understand, just let me know. Okay. Okay. So let's start with the psychiatry. It's actually an interesting subject for MRCP. Though the questions are not so much, but very important for the exam. It's related mostly with the neurology questions and also some pharmacological questions. So we need to know the psychiatry because they will number it separately. So its numbers are matters actually in the exam. Because if you get zero in psychiatry, then it will be hamper your total passing mark. That's why we need to know. Okay, so firstly, we will go for the unexplained symptoms. Nowadays, it's called about medically unexplained symptoms, MUS. So, what are the unexplained symptoms which patient cannot explain clearly? Like, look at this somatization disorder. I think some of you can heard this uh, term, like about irritable bowel syndrome. That is one of the somatic disorder also. And there are in every system there are a lot
Sir,
functional. Hello,
sir,
yes.
your voice is not clear.
Oh, it's breaking.
Yes,
Hello, now it is clear than before.
yes.
Okay, there is some noise from. Okay, now somatization disorder, you know that there are a lot of somatization disorder. You already I think read about the systems like GIT system. You found irritable bowel syndrome, and there are some other points like fibromyalgia in the rheumatology system. So these all are the somatization disorder actually. But what we need to know specifically what is somatization disorder. Actually, in a word, we can say somatization disorder is a physical symptom. Patient have some physical problem. You must admit it that these physical symptoms is real. Usually in PSS exam, in the final exam, you have to deal with this type of patients in counseling sessions. So at that moment, you must admit that this patient's symptom is real. This is not any kind of intentional things. They suffered a lot with this problem. So it is not intentional. You first admit it. You need to admit it. It is not intentional. Okay, it is involuntary. Another point, it is involuntary. And there is no secondary gain and no financial gain. The financial one is added by me to understand the secondary gain actually. Because in secondary gain, he has he will have some motives that he need to gain something like financial money or some promotions or something like that. So that is not present in this somatization disorder. Okay, so be clear about these points. It will help you regarding the scenarios. I will show one scenario then after this description. So look at this: not intentional, involuntary, no secondary gain, no financial gain. Okay. Now the criteria is multiple physical symptoms, at least 2 years, more than 2 years, or more than 6 months. Okay, it should be more than 6 months or more than 2 years. Both can be present in your stem. You can find in past medicine, in past test, and other on exam. All other things, there should be some duration. And the age is important. Usually, somatization disorder occurs in youngers, not like elders. Okay, less than 30 years, more. So nothing absolute actually, but you need to think in young patient, there could be some symptoms like this, two or more GI symptoms, one reproductive symptom like sexual symptoms, one neurological symptoms could be there. These are not absolute, but this could be present. And most interesting thing is diagnostic test must be normal. This is the most important part. That's why I just advise you all. to go through the first stem, like 1, 2, 3, 4, 5, 6, this stems, answer stems, and then go to the from below to upward in the question, because you should just go for the endoscopy findings, CT abdomen finding first. Then you can read from the start point. Okay, I will let you see with the question. All investigation are normal. CT abdomen normal, endoscopy normal, everything is normal. So what will be the positive factor? The stress and anxiety. Look, this is very important. Stress anxiety. They will not tell you in the scenario that there is a stress. There is a stress. They will tell that he is some anxious about his life. They will tell you some story. Okay, that this patient is very much upset. But directly stress will be not related with the question. Look, there are some key points you need to understand. The key points is this: if there is any kind of stress in scenario plus GIT symptom, it should be IBS at that moment. If there is irritable bowel syndrome, is there. There are some criteria of irritable bowel syndrome. You should correlate with that criteria also. But there would be some stress, like exam stress, like any kind of meetings, any kind of interviews. So the patient feeling abdominal pain, bloating, and motion, and multiple visit to the OPD, outpatient department, and also to the consultants. So multiple visit would be there, like more than 6 months or more than 2 years. Okay, so this is the key point you need to understand for irritable bowel syndrome, unlike functional symptom or not. Multiple physical symptoms means any type of physical symptoms like muscle pain, chest pain, costochondritis pain. So all of this included with the multiple physical symptoms. That is somatization disorder. Clearly, the bold point is somatization disorder. Another thing you should find is stress, irritable bowel syndrome, and there is some tender points. Look the tender points. If there is any tender point presented, if you just read the rheumatology about fibromyalgia, you can find the tender points. There should be some tender points with some stresses. I think there is noise. You can mute yourself. Okay. So that is fibromyalgia. These key points are very necessary. You read a lot during exam, but these key points will help you regarding revision. So it's very, very important. I think it will help you in future. So treatment, you should not go for any medicine. You should go for psychiatric referral and refuse. Patients you will give reassurance, but patient will refuse multiple times. So these are the gross treatment. And they mostly in part one, they will give you to diagnose the patient. Did you diagnose the conversion disorder, hypochondrial, and also did you diagnose the somatization disorder clearly or not? Because ultimately you will refer this patient to psychiatry. So this is one of the description for irritable bowel syndrome, the common disorder, abdominal pain, bloating, gas. I will not describe it a lot because it is part of GI system. So in the you should read the all functional diseases in every systems. Like in GIT, this is irritable. In rheumatology, fibromyalgia, and chronic fatigue syndrome, you should read it with the psychiatry subject. Okay, I think that would be more better. Okay, irritable bowel syndrome, you should read it by your own. I will go to the another somatization disorder. I will give this note to you. Okay. Now, hypochondrial disorder, another somatization disorder, but nowadays they will transfer this disorder to another stem, like in delusion. But so far, the question coming with the somatization disorder. So this is one of the classification of medical unexplained symptoms. So hypochondrial disorder, it is a delusion actually, false belief. Patient have some strong belief of having cancer, but patient is okay. Cancer belief never accept the reassurance. Family history must be present there. Family history. The his parents or his mother, father, or aunt, anyone can suffer from the cancer, but he is not suffering from, he or she is not suffering from the cancer, but a strong belief over there. This is very, very important. Persistent negative belief, but you will reassure, they will not accept it. Just like this, you will go for answer hypochondriacism. This is very, very important. You will find it out in your exam mostly. This is very, very important to identify this hypochondriacal disorder, and it is so much easy. So that is a someone look. I have given one example. Someone believes that she has pancreatic cancer, just like her dead husband. Husband is dying of pancreatic cancer, and this is one of the hypochondriacal you should think of, because there is no weight loss, nothing like any kind of malnutrition and all other things that could indicate the cancer. You should read it at that step. I will share it with you. The question. Now another one, conversion disorder. Conversion disorder is the rule of exclusion actually in the scenarios, because conversion disorder they will give this question with the paralysis like a stroke and any other lesion, neurological lesion. They will give it to you like that, because this is one of the disorder you will find the patient paralyzed, like limb weakness will be there, and it is not uh, he's malingering or he's just go for the consciously that I have this loss. Is really there is real loss of motor function. Look, limb paralysis, not consciously done, not feigning the symptoms. He's not acting actually. That is the not feigning the symptoms, and loss of motor function, limb paralysis or non-dermatomus sensory loss could be there. So, in one way, you can say unresolved conflict convert into physical symptoms. There are some problem or there are some conflict in his life that convert into the physical symptoms. This is very important one. They will mostly give the paralysis there. The patient having limb paralysis suddenly, like a stroke or like any neurological issue. So this is conversion disorder, very easy, and this scenario will be a bigger one. The conversion disorder. You might say this is, there is loss, there is no jerk present, and the patient having this sensory loss also. So a lot of it, but at last the answer will be conversion disorder. I will show it to you the scenario. The history of some stress like work stress and relationship stresses, financial stresses. Stress is over there. All examination and investigations, it's sometimes found normal, sometimes they give examination like they find that there is some loss of muscle power. Could be there, but maximum time the investigation would be normal. So do not be biased with the examination part. Sometimes they will give you that examination showed unremarkable. So it could be possible in case of this psychiatric manifestation. But investigation will be normal. This is true. No organic cause, there will be no brain problem or no other spinal cord problem, and no material gain. He would not like to gain some financial benefit or some other benefit. Just he or she is in stress, and then there is limb paralysis. So that is conversion disorder. A nurse receive a patient with paralysis. Look, this is nurse is the patient. Example, she developed one-sided paralysis. This is the nurse developed one-sided paralysis suddenly on that day. Similar day, that nurse receive a patient with paralysis, then the nurse is suffering from the paralysis. She cannot remember actually what happened to her. The examination test is normal, no organic basis there. This is one of the scenario of conversion disorder. Very, very important scenario. How you can judge this patient, how you can understand that this patient is malingering or this patient have real paralysis or not. For this, there is a Hoover's test. Look, the Hoover's, Hoovers, Hoover's test, Hoover's sign should be done. This is, did you do this in your work? This is very commonly done if any patient suffering like this. Positive, it's a conversion disorder. This is a Hoover's sign. Patient, I have described it, patient placed in supine position firstly. Then there is a paretic leg and non-paretic leg. You should compress, tell the patient to compress the non-paretic leg against the resistance. Then paretic leg will give the pressure. So if there is paralysis, there would be no pressure. synergistic, no pressure if you raise the resistance. Okay, but if there is this conversion disorder, he or she will give you the pressure in opposite side. Like in paralyzed side, they will give the pressure. This is the Hoover system. You can see this in YouTube. This is very easily they have been described. So non-paralytic leg actually will give the pressure when you just move the good leg. Non-paralytic leg. If you give the resistance to the non-paralytic leg, then you will feel also some resistance from the paralysis leg. Okay, this is some synergistic action. If you flex your if I give you some example that the patient have you just see a patient, that patient have right side paralysis, right limb paralysis. Okay, these are both limb. This is right, this is left. So if the patient has symptoms of right side paralysis, you will give a resistance over this thigh, the left side. You will tell the patient flex the left thigh heavily, and you will put your another hand to the heel of the right paralytic leg. Then whenever you give resistance over the left side, please give pressure to my left hand. He will put a pressure on the right side. This is Hoover's test. Okay, because if the paralysis present, she or he will not put the pressure from the paralytic leg, but you are giving this resistance to the left leg, and she is pressing you with the right to give the more resistance. So that's why there is no paralysis actually. So this is very easier and very nice test actually, Hoover's test. So if Hoover's test positive, you will answer the test as a conversion disorder. No, that is very easy. So I think these three things you understand better. Now I can go for a scenario so that you can just understand right now about this problem. Because these three is very important. You will get one question mostly. This is question out actually. You will get one from these three mostly. I'm just sharing the question. Okay, one of you can read it clearly. Anyone can join the question rapidly.
A 32-year-old woman is referred to the Department of Gastroenterology for a further opinion, having developed constant periumbilical pain radiating to both legs. Over the past 5 years, she has been seen by colleagues in neurology, cardiology, rheumatology, and endocrinology with a variety of symptoms, including fatigue, back pain, chest pain, and joint pain. Despite intensive investigations, no cause for her symptoms has been identified. What is the most likely diagnosis?
Okay. Now you can understand the investigation is normal and multiple visit over there. No? And a lot of pain, back pain, chest pain, joint pain. So there is a lot of pain. So which could be the involvement? What is the most likely diagnosis?
Somatization disorder, sir.
Yes, very nice. Somatization. I think you understand very well that this is a somatization disorder. No, it is not a hypochondriasis because there is no family history of cancer. There is no false belief. Hypochondriasis, that's why actually delusion. Conversion disorder, no, there is no paralysis, no neurological symptoms over there. So you could not think of it. Depression, there is no chance of depression here also. Low mood, loss of energy. We will read about the depression, then we will know better. Undifferentiated somatoform disorder, no, this is something you need to go for the specialist psychiatrist. So this is close. So this is somatization disorder. This can be more bigger. This scenario can be more bigger sometimes, but you need to stick on the investigations. So read it out from your lower side to upper side. That's why I'm telling you should go for think of the investigation first rapidly. What is most likely diagnosis? Conversion, depression, hypochondriasis, somatization, and okay. So this is a psychiatric question. Now, despite intensive investigations, no cause for her symptoms. Okay. So I think investigation is normal. So any of the psychiatric symptoms, then multiple pain, this is somatization. This way you should complete your answer.